Hey, it's Dr. C. Glad to see you again. Glad you're with me. Today we're going to talk about colon and rectal cancer. Now, why? Been around a long time, obviously. And the reason I'm talking about it is because it now has become a big deal because there's been an increased incidence of colon and rectal cancer. In fact, in GI cancers in general, in a younger population. So before, when it was just the older folks, they don't give a crap about them. So younger population went up 2% last year. 2%. Now, when you're dealing with hundreds of thousands of people, that's a fair number. The elderly, which the elderly, they define over 60, but they went down 1% because the elderly are having their colonoscopies, sigmoidoscopies, having all that stuff done. So it went down 1%. So a little bit about colon cancer, and then we're going to talk about the screening procedures for colon and rectal cancers, because there's been a lot out there now. A lot more than when I was practicing medicine. So let's talk about it. Colon cancer, colon and rectal cancer, third most common cancer out there. Third most common. And when you look at the numbers, in 2023 in the United States, 106,590 cases of colon cancer and 46,220 rectal cancers in a year. And that translated to 53,000 people dying in 2023 of colon and rectal cancer. The numbers are not small. It's a fair number. So, with that in mind, we need to look at it. How do we diagnose it? How do we treat it? Okay, let's go into it. First of all, if you look at the people who have had colon cancer, roughly about 30% of the people who have it have a positive family history. But of the people who actually have a biopsy-proven colon and rectal cancer, roughly about 5% have a positive family history. But still, the family history is important. So, I should mention now a little bit, just as a diversion. A lot of you still remember, I'm sure, Katie Couric. Katie is a well-known, well, maybe not nowadays, but a well-known journalist. In fact, she anchored the Today Show for quite a few years. Her first husband died at age 42 of colon cancer. Had minimal symptoms for a year or so, and then presented with stage 4 colon cancer. Her husband died. That was back in 1998. Well, Katie, being a very meticulous journalist, looked into colon cancer in general and how we can help to prevent it. So in May of 2000, right on the Today Show, there was a segment of Katie Couric having her colonoscopy done. The year after that, there was a 20% increase in the number of people who had colonoscopies done in the United States. They called it the Couric effect. That shows you how popular that show was and what it meant to have somebody of her stature have the colonoscopy right on screen. Fortunately, it was negative. Well, since that time, she has remarried happily. And unfortunately, she's had breast cancer as well. Right now, free of cancer. Free of cancer. So that's the Katie Couric story in a nutshell. So that shows you the value, basically, of colon cancer screening. Now, when I was practicing medicine, what I would do a good rectal examination on the annual physical, check the prostate, obviously, check the mucosa of the anal and the rectal area with my finger, and then take a little dab of the stool or the poop or whatever you want to call it, put it onto a little slide. Now that slide is called a guaiac slide, and they're still available. They're still available. That little piece of paper that you put that smear on has been soaked already in what's called alpha guaiaconic acid. It comes from the, I believe, the guaiacum resin from the guaiacum tree. So that's soaked in that. Now, if you put some drops of hydrogen peroxide on that, it immediately turns bright blue because of the reaction with that guaiaconic acid. So we did that, and it's still of value. It still works. There's still a decent sensitivity to it. So guaiac is out there. What are some of the other things that are out there to diagnose colon or rectal cancer? Well, it comes in 3 different categories. Number 1, the stool-based category, the poop. I told you what we did was the finger, smear, and guaiac test. Still out there. That's one test. Now they have 2 other tests as well. One is called the FIT, F-I-T, FIT test, fecal immunochemical test. FIT. What about the FIT? What value is it? Well, first of all, it has to be ordered by your doctor so that maybe your insurance will cover it. Now, if you have no insurance, the FIT test would probably, you can still get it, of course, and it costs you roughly about $25 to get the FIT test. Now, you can get a special 2-in-1 for $30, but say $25 average cost for the FIT test. Now, what is the FIT test? Well, you get your kit in the mail, and the kit has a place where you can, just like you use that guaiac paper to put the smear on, there's that little cage that you can put it in, and then it comes with 2, like little, I guess you might call them like little brushes. 2 brushes, we'll call them. Very small brush, obviously. So you go, you take your poop, no special preparation needed, take your poop, and then you need to, ahead of time, you make sure that there's nothing else in that toilet water. So you need to flush 2-3 times to clear out anything else that might be in that water. Okay, so you take your poop, you use your little brush, and you brush the surface of the poop and put it on one of 2 of the slides that they give you. And then the next time you take a poop, you do the same thing with the second brush and the second little container for the poop. And then you mail it back. Now, what do they do with that material that you send back? They're not going to do a guaiac on it. No, this isn't a color test. What it is, basically, they're looking for antigen from colon cancer, because the colon cancer will shed some of its cells. Some of it is antigenic. It is an antigen. And so by using antibodies, they can predict if you have colon cancer. They can't tell you where it is, how large it is, can't tell you anything like that. You need to have a colonoscopy then But nevertheless, the test is pretty accurate. When you look at the sensitivity of that FIT test, it approaches roughly a 90% sensitivity. That's not bad. Not bad. What does it cost for a FIT test? Costs only about $25, like I said. So that's something to put onto your list. Some people will opt to have the FIT test every year. Fine. And that is approved. It is approved. I don't know if your insurance covers it. You got to ask that question, because the insurance companies, I don't trust a damn one. So you got to ask first. So that's poop test number 2. Now, what about poop test number 3? Well, that is a thing called Cologuard. Cologuard. Now, what Cologuard uses is a dual test. Tests 2 things. Number 1, it does a FIT test. It looks for the antigen from the DNA of colon cancer cells. So they do that test too. But also besides that, they also look at, they also look at some DNA markers as well. So they look for the hemoglobin, the blood, and they look for the colon cancer antigen. They look for both. Cologuard test has to be ordered again by your doctor in order to be covered by insurance. But you always check first. Always check first. Because if it's not ordered by your doctor, or if you don't have insurance, it costs up to $500 for a Cologuard test. Okay. It takes about 3 to 4 days, and then you're going to get your answer, whether it's positive or negative. Has a very good sensitivity, probably about the same actually as the FIT test, maybe a tiny bit more. That's about it. So that is the 3rd stool-based test for colon rectal cancer. Now, that's one. Now the next one, visual test. Something you can see. The most common one, like the one that when I was in practice, we would do what they called, they would call it a colonoscopy, but we called it a proctoscopy, because what we would use was a metal tube, a little more, maybe 14 inches in length, and you would get an enema to clean out a little bit. You would be on a clear liquid diet for several hours, actually half a day. And over you go, in goes the scope. Now, we did pick up a number of cancers in that way, picked up a number of polyps that way. The other advantage to it is that if you see a probable cancer, you can biopsy it and document exactly where it is. If it's a polyp, you can remove the polyp, send it off to pathology to have them look to see if it is cancerous or not. So that was a test that we did on a regular basis. The second visual test that's done is an actual sigmoidoscopy. Now, the sigmoid colon, you have the rectum and then the sigmoid colon. It's like an S shape to it. Now, with a sigmoidoscopy, they go up roughly about 40, maybe up to 45 centimeters. Remember, 2.5 centimeters is an inch. So 40 to 45 centimeters up into the sigmoid. And again, they can see if it's a polyp. They can biopsy or remove the polyp. So that's the value of the sigmoidoscopy. Again, it's an approved visual test and costs $10 depends upon really where you have it done. They're doing a sigmoidoscopies now as an outpatient. Some of them even do it as a big office procedure, and it may cost anywhere between $200 to, depending on whether they do the biopsy, etc., $200 to $600. So that is a sigmoidoscopy. It's an approved test, and they want it done roughly every 5 years. Okay. Some downside, they're not looking higher up in the colon. They're not looking at the other side of the colon. So they're going to be not even able to pick up a number of either polyps or colon disease. Okay. But they are able to pick up roughly, depending on which article you read, they can pick up anywhere between 40 to 60% of those polyps or cancers that are in that segment of the colon and rectum. Okay, so let's go on from there. You can also have a full colonoscopy, which means that they now go all the way around, all the way, the left side and the right side of the colon. Obviously, they pick up more cancers and more polyps. So there's that one big advantage. Disadvantage is, unfortunately, you got to prep. You got to clean out. And so there's two ways of cleaning out. One, you use a big jug, a gallon jug of this crap that they give you. You can put flavor in it, but it is not pleasant drinking down a gallon of this crap. They now use a split test where you drink half of that crap early in the evening and then the other half in the early hours of the morning. That's a split prep. Cleans you out even more so that they can get a nice clean look at all of the colon. Okay. Again, that is sort of the gold standard. They pick up the most of all of the testing that is done, the screens that are done. You can also have, but unfortunately there are some potential dangers, risks, you might say, to colonoscopy. You get somebody who may not be totally experienced. By experience, I mean done at least 50 of them. So there are a very small incidence of perforations, splitting the wall of the colon, bleeding, especially if they take out a polyp, because there's always an artery and vein going into that polyp, and if they don't tightly get that band on that base of the polyp, it could bleed. So bleeding is another potential complication. So those things need to be considered, obviously. What else? There's a third form of visual, and that's a CT colonography. They call that a virtual colonoscopy. CT colonoscopy. So it combines a CAT scan and a colonoscopy. So you got to get a clean colon, number one. Can't avoid that. The cleaner the colon, the better the test. Now, when you come in for that to have it done, they may give you some oral contrast. They may put a little tube up the rectum to put a little air, carbon dioxide in, so that opens up the colon a little better, and they can get a better read as the material that you took, the oral contrast, comes down, and they can pick up pretty accurately any defect, like with a polyp or with a cancer. So that is a CT colonoscopy. That costs roughly about $650 average if you don't have insurance coverage. Oh, I should mention the full colonoscopy cost averages $2,750. So it is advised or recommended by the powers that be that you have your colonoscopy done every 10 years if you have a negative colonoscopy. You should start it at age 45. If you have a positive family history of colon cancer or rectal cancer, you can start at a younger age. I would even recommend as young as 35 if you have a strong family history of colon and rectal cancer. Of course, you could always put it off, too, if you have no symptoms, no blood in the stool, etc. Your bowels are moving regularly, you're feeling healthy. You can put it off, but the recommendation is to start at age 45. And that's true of all of these visual tests. What's the third type? Third type, blood test. Now, blood-based test, one is called the Giardiant. Not because of Giardia, but the Guardiant test. Again, age 45, people at average risk, and you have to have a doctor's order or it won't be covered. It may not be covered anyway, and it costs roughly $895 average. That detects colon or rectal cancer DNA. Okay, pretty decent sensitivity, pretty decent, 83%. Now, what is this sensitivity nonsense? That means if you have colon or rectal cancer, it will pick it up positive. Specificity means if you are negative, it will call the test negative. So remember those two terms, sensitivity, specificity. Each test has its own testing like that. So that is one of the blood tests. The other one, called an epiprocolon test. Now again, comes in a kit, and it will it's a finger stick, and it picks up basically methylated genes. So methylation goes on with some of these colon and rectal cancer genes, and if they are methylated, that is a high incidence of cancer. So every 3 years, if you're going to go with that route, you need to get that done. The other form of blood test or genetic testing may just be a swab of the lining of the mouth, or it may be an actual blood test. But there are a lot of genetic tests that are out there to screen for cancer. The main ones are looking for some of the syndromes that are associated with colon and rectal cancer, such as Lynch, L-Y-N-C-H, Lynch syndrome. That usually looks for what they call mismatched repair genes. Now, I'm not going to go into all of the details of that, but that's what it looks for, and it is reasonable. There's also familial polyposis. Younger people who will get thousands of these little polyps in their colon and even in the small intestine. Fortunately, most of them are negative, but increase incidence. There's a thing called Peutz-Jeghers syndrome. People who have what look like pretzels. Why do I say pretzels? It's freckles in their lips and on the mucosa in the mouth, on the soles of their feet, freckles, and a number of polyps. Peutz-Jeghers syndrome. You can also have genetic testing. In fact, there are companies that are producing kits for genetic testing. It's mostly for breast cancer surveillance, but also now with neurodegenerative disease in kids. They can pick up autism, pick up a number of neurodegenerative diseases in children. So it has its value, and it is gaining in its value all the time. So what about these polyps? Let's say you have a polyp removed. What's important about polyps? Well, most of these polyps are what are called adenomatous polyps. And the adenomatous polyps are defined, I guess, basically by the way they look. They can look like a mushroom. They can look like fronds, like a number of fronds. But depending on what they look like, they can be either what they call villous or tubular. You can also get inflammatory polyps, people who have Crohn's disease, people who have ulcerative colitis. They're the ones who can develop these inflammatory polyps. You can also get what they call hyperplastic polyps. Just a lot of activity and forming little polyps as well. Any polyp that is under 1 centimeter has a low chance of being a cancer. Not zero. No, not zero, but a lower chance. In fact, fortunately, 75% of all of the polyps removed are under 1 centimeter. If they are 1 centimeter, 10 millimeters, 1 centimeter is a much higher risk of cancer of the colon. 2 centimeters, 50% of them are already cancerous. So polyps really need to be screened, and screened well. So with that in mind, I don't want to go into other details of colon cancer. This was mainly a talk about how do we screen for colon cancer. We might even have a little talk about screens and other cancers in the future as well. Okay, this is Dr. C. I hope you have a nice day. Get your screening done for colon cancer.